13 million people die every year of the effects of climate change. And that is almost twice as much as the people that died during the pandemic. So it is a significant amount of people that suffer and die, unfortunately, every year because of the causes of floodings, of heat strokes, etc. So there is a huge need to act. And fortunately, there's many solutions and collaborations, which I think we'll speak of later in the conversation.
Welcome to the Health Beats podcast, brought to you by the inaugural Abu Dhabi Global Healthcare Week. The Health Beats podcast series is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We give you an insight into the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Lara Satrakian, and in this week's episode, I'm joined by Stefan Weber, Vice President of Global Policy, Advocacy and Health Equity at AstraZeneca. Our conversation today is entitled The Climate Crisis and Healthcare's Carbon Footprint. Stefan, welcome to the podcast.
Thank you so much, Laura. It's a pleasure to be here.
What are some of the things that worry you in terms of the impact of climate change on global health?
That's a great question. Look, there's many things that worry me, but this conversation obviously will be very positive as well. There's a lot of solutions, but I think first of all, we have to recognize that 13 million people die every year of the effects of climate change. And that is almost twice as much as the people that died during the pandemic. So it is a significant amount of people that suffer and die, unfortunately, every year because of the causes of floodings, of heat strokes, etc. So there is a huge need to act. And fortunately, there's many solutions and collaborations, which I think we'll speak of later in the conversation.
What are some of those that account for the deaths caused by climate change? What's really hitting people the hardest?
So first of all, we have to recognize globally we live in an aging society. So particularly the elderly, the frail people are very much suffering from heat strokes. But then floodings, as you just had in the UAE a few weeks ago, have a huge impact on humans, but then also on the economy. But then also pollution. If you think about it, 99% of the world population does not live under the air quality that the WHO would recommend. And so air pollution is causing chronic obstructive pulmonary disease, lung cancer. And these are just some of the examples. But unfortunately, more and more people are suffering from the detrimental effects of climate change.
And how about the reverse? How is the healthcare sector impacting climate and environmental well-being and safeguarding?
Oh, that's a great question, which is usually forgotten. But indeed, the healthcare sector, and we are trying to take care of the ill people, but also the healthcare sector has a major contribution to greenhouse gases. So 4%. More or less of the global greenhouse gases are emitted by the healthcare sector. That is more than the aviation industry or the transportation sector, which is quite astonishing to many people. And there's two main causes for that. First of all, it's through the production of, it can be medicines, syringes, protective equipment like gloves and face masks. So it's the production, the distribution, the usage and disposal of these products that cause a lot of greenhouse gas emissions, but then also the healthcare facilities, hospitals, the energy, the water usage, etc. And so there's the two main areas of focus if we want to think about green healthcare systems, which we can also speak a bit more of, but the healthcare sector has a major contribution also to make to ensure that greenhouse gases are avoided as much as possible and we keep the planet healthy.
I had no idea that the healthcare sector emits more than the aviation sector. I think that would surprise a lot of people.
Yes, absolutely. Every time we unfortunately have to tell that fact, it does surprise. But I think, building awareness is quite important, and also recognizing that everyone has a role to play as individuals, as companies, but also, as different parts of the government. And so fortunately, we see more and more action and also concerted action, collaborations to tackle really the root causes of greenhouse gas emissions rising from the healthcare sector. And one aspect that I'm particularly interested in is the earlier detection and treatment of disease, because It's through progressing stages of disease and more serious disease that then people have to go to the hospital in the first place and consume intensive care, for example. And the worse your health is, and the more intense the care gets, the more greenhouse gases gets emitted through the products that you use and the number of days that you have to spend in the hospital. So for us as a pharma company, we're in the business of developing generally innovative medicines, but without a healthy planet, it's really a moot point. And so it's really important that we shift healthcare to earlier stages of disease where the outcomes for patients are better, but then also the greenhouse gas emissions are much less.
I had no idea that preventive healthcare and eco-friendly healthcare were so intersectional and had so much common upside. It's really
totally.
eye-opening.
Laura, I can give you a few examples. I mean, it's quite astonishing, but if you think about chronic kidney disease, and as kidney disease progresses, ultimately it can lead to kidney failure. And maybe you've heard of hemodialysis. That's when patients then on dialysis, they have to go to the hospital 3 times a week, 4 hours every session, and basically their blood gets filtered. And that has a huge impact on people because, they can't work fully anymore. Oftentimes a caregiver also accompanies them and also is pulled out of the economy during that time. But then also in later stages of kidney disease, treating kidney disease with dialysis causes 450% more greenhouse gas emissions than if you treat kidney disease in stage 3 rather than end stage. So it's really important that we identify diseases earlier and treat them earlier. And just as the example of kidney disease, many other examples exist. I spoke about lung health, lung cancer, COPD before. And COPD is the number one cause of hospitalizations in many countries.
What is COPD for those who don't know the term?
COPD is chronic obstructive pulmonary disease. So it's caused, for example, by pollution, by smoking, and basically the lung develops a thick mucus that then creates difficulties in terms of breathing, damages the lung as well, but then breathlessness, fatigue, and maybe you've seen the people that require oxygen through their nose to supplement, to help the lung. And so chronic obstructive pulmonary disease is a disease that 400 to 500 million people suffer from across the globe. And I said pollution is one of the risk factors, and you can also prevent it. That's, I think, the thing with many of these so-called non-communicable diseases, that you can actually prevent them.
Are the numbers going up?
Well, the numbers, unfortunately, they are going up, and so that is why, if we think about sustainability, that is why acting early is so important, because it's the increasing burden of chronic diseases such as COPD or lung cancer or kidney failure, that is undermining the sustainability of health systems as well. You remember in COVID, hospitals were already full and overburdened. And then the shock came, the pandemic came, which led to disaster, across health systems globally. And so if we think about really having a resilient healthcare system, one that is sustainable, we need to keep patients out of the hospital. And the best way to do that is to, as said, act early on disease.
When you think of climate and healthcare, does the profile risk of another major pandemic cross your desk? Is that part of the conversation today?
So it is a part of not just our discussion as AstraZeneca. Maybe you remember, we also developed a vaccine during the pandemic. But we created, together with the World Economic Forum and governments and researchers in over 30 countries now, what we call the Partnership for Healthcare System Sustainability and Resilience, to precisely study what do health systems need to do to be on the forefront and prepare for a next shock. And a shock, it can be a next pandemic, but it can also be a cyber attack. It can be natural disaster. It can be armed conflict. There are many things that temporarily put the health system under immense stress. And the problem that we had with COVID at health systems, they were already overburdened by the increasingly chronically ill population. that very few health systems are actually prepared to absorb the additional stress coming from a shock. And so that's what we've been doing over the last 3 years in partnership across the globe, studying health systems and what can be done to really build resiliency and sustainability into the system.
Is there an assumption that with the patterns we're seeing in terms of climate change, that we will see more pandemics and pandemic shocks to the healthcare system? Is this taken as a given, or it's just one of those open questions?
I would just say a shock can always occur, right? There are different forms of shock. And what we learned from the pandemic, also through this Partnership for Health System Sustainability and Resilience, that there are a number of things that governments can do to prepare the system for any shock. And so it's better to be safe than sorry and better to be prepared than not. And although several countries had pandemic preparedness plans, for example, before the last pandemic, many of the recommendations were not implemented. These are recommendations in terms of having financial reserve, having excess capacity in the system, but then also pivoting healthcare to be more proactive and keep patients out of the hospital. There's many things that can be done to keep patients out of the hospital so that when a shock comes, that you can then treat people in the hospital. So I'm more interested in what can we do today to be prepared rather than speculating or anticipating when the next pandemic could happen.
So talk to me about eco-friendly healthcare. If we're looking at it in an ideal state, break down for me what transition we have to make for existing systems and how do we have to plan differently for new greenfield build-outs to just completely transform the environmental footprint of the healthcare sector.
Yeah, thanks, Laura. It's a great question. So there's a number of examples and good practices, particularly if you think about it, the Middle East is leading the way in many cases. So in Egypt, for example, the Ministry of Health is in the process of certifying 100 green facilities. So these are healthcare facilities where the carbon footprint has been identified, strategies have been developed to diminish the carbon emissions, for example, of those hospitals through cleaner heat, better usage of technology as well. And in Jordan, the same is happening. And in other countries like Turkey, solar-powered mobile units have been deployed during the last earthquake. If you remember, in February 2023, there was a major earthquake. Mm-hmm. And so now solar-powered mobile units have been deployed to go to remote areas to help. And these units now will be used beyond, obviously, disaster relief to provide care in more remote areas. Because I think we also recognize one thing, that people that are most impacted by climate change are people that are already vulnerable, that, for example, live in remote areas or for socioeconomic reasons have less opportunities to access the health system, the elderly or children. And so it's really imperative that the healthcare system finds new ways to go to the people proactively rather than waiting until they present into the system. So those are just some of the examples of leadership in the Middle East. But then I would add across the globe, over 75 countries have now signed up to what is called the WHO ATTACH, which is the Alliance for Concerted Action on Climate and Health. And the UAE is a co-chair of WHO ATTACH, so also there in terms of bringing governments across the globe to commit to do more on climate and health. The UAE and the Middle East is showing tremendous leadership.
We've all seen the pictures of medical waste, trash for single-use plastic, because it has to be single-use plastic. We all experienced that during the pandemic. Is there a conversation afoot around recycling differently or approaching medical waste differently, and that contribution to the climate equation?
Yeah, another great question. Yeah, indeed, Laura, you're right. I can give you one example of what we are doing in partnership with others. Maybe you've seen in medical packages, there's these printed leaflets, the things that if you unfold them, they spread across the kitchen table. So we are moving to electronic product information. And that, saves many trees, and thus is a contributor to carbon, and obviously reduces waste at the same time. And so AstraZeneca has been involved. One of our board members, Nasneen Rahman, has been playing a pivotal role also in getting really broad action. And so we are working with governments on implementing that. Japan has already moved to electronic product information, and other governments across the world, other regulatory agencies are looking into doing the same. So that's just one example. I think another is then, clean energy and heat. So one thing that we are doing in multiple of our countries is really changing the source of energy. So in the US, we are partnering with Vanguard Renewables. And basically what we're doing, it's very cool. We're using biomethane gas from farm and food waste, and we are converting that into energy, and that fuels our R&D operations and manufacturing. So through renewable energy, we're powering our scientists to do their discoveries, and hopefully the next treatment against cancer or COPD will come out of a lab that has clean energy from biomethane gas.
Just to make it clear to listeners who aren't familiar with biomethane and biogas, this is the poop to power facilities. So taking the byproducts of agriculture and, as you're saying, food waste. So it'd be very interesting if we go poop to power to vaccine intervention, and that'd be very interesting to see a few years out, correct. Hopefully. So that's one. Not the easy, but the first achievable steps in terms of energy transition plus healthcare. Any other emerging technologies or ideas on the horizon for how to green the healthcare sector, how to recycle differently? Anything that comes to mind that really excites and inspires you?
Yeah, totally. For me, the biggest potential, again, is to keep people healthy. And once they're ill, to detect diseases early. So there we see numerous applications of artificial intelligence, AI. So, for example, in the area of lung cancer, we are partnering with Cure AI. This is an AI company where basically what you can do today is use a normal chest X-ray, and then the primary care physician can download an app, and the AI algorithm is on that app, and you can scan the chest X-ray for nodules that would suspect a lung cancer case. So this helps federate and democratize basically lung cancer screening, so you don't have to go to special hospitals necessarily. You can do it in the primary care setting, and once there's a suspicion, then you can go to the hospital. So it makes it much easier. It's lower cost as well, and we have committed to do 5 million of such scans by 2025. Another application of AI is in the area of chronic kidney disease, or in heart failure as well. In heart failure, an average diagnosis in some countries can take 6 to 12 months because you have to do an echocardiogram in the hospital. So also through handheld ultrasound device using AI, you can shorten the diagnosis time down to 6 weeks. So in a partnership with the Scottish National Health Service, we were able to show that we've reduced the waiting time to get a heart failure diagnosis from 12 months to 6 weeks. Many more people were able to get a diagnosis, less waiting times, lower cost to the system. So it's a win for everyone. And I think it's, these applications of technology that have a huge potential to green the whole healthcare, but also to make major contributions to better population health.
Do you feel the AI is getting smarter, or we're getting smarter about the use of the AI, issues like false positives and training these AIs better? Do you see this in action?
We are using or looking into using AI across the board, from our scientists and in the discovery of new medicines, all the way to helping the health system manage disease, as the two examples that I just gave. So, of course, there's always a regulatory process behind before you can scale technology. But, there's, I think, tremendous opportunity, and we are finding ways how to use AI in a very smart and safe way so that it then can be scaled to the benefit of people and the planet.
I think AI for drug discovery, bioinformatics, I suppose, absolutely fascinating. Anything more about that you can share to help us understand how much faster your field is going to work because of AI? This is very, very potentially transformational.
We have spun out a whole unit called Evinova to look into we have different solutions where we apply technology, including AI, for the better management of clinical trials as well. And we are offering these services also now to to others. That's why we've spun them out, so that we can partner and collaborate with other companies, even potential competitors, because there's so much, right, that technology offers that is good for humanity. And so, that's why we have created this whole new business model around the company that is called Evinova.
So that's one application of digital health, so to speak, digital health research. Are there other fields of digital health that you think are going to really move the needle in terms of environmental impact or overall modernization, bringing the healthcare sector into the future?
If we talk about digital, I would like to focus on one of the biggest opportunities, which is actually digitizing healthcare altogether to have better decision making. And I'm not just talking about electronic medical records. I'm talking about population health management and really understanding through the pooling of different data sets which people in a country are at the most risk of a certain disease. Because there's behavioral risk factors such as smoking, but then there's genetic risk factors, socioeconomic risk factors, and it really boils down oftentimes to where you live. That determines how many opportunities you have to access the health system and get an early and timely diagnosis, get the right treatment. But populations are different, and people have a different experience as they go through the health system. And I think there's a lot of potential in really understanding what are the different problems that people face as they go through the health system, and why are some getting a timely and correct diagnosis, but many others aren't? Why are some getting guideline concordant care and others don't? And health insurance and wealth it's not the only reason why there's differences. There's many other differences. And so I think health systems can do much more to really study what is at the heart of these different experiences, and how can we develop solutions and bring healthcare that is appropriate for the different people, and how they experience medicine. I think in terms of health equity and giving everybody the opportunity to live their healthiest life, data can play a huge role. So that's kind of first and foremost what I'm interested in. Secondly, coming back to this partnership for health system sustainability and resilience, data plays a key role in surveillance, in monitoring the overall health of healthcare systems. And I'll give you an example what I mean by that. Currently, health systems only spend 3% of their total funding on prevention, on screening, on vaccination, on keeping people healthy and detecting disease early. 97% of all resources are used when the patient presents to the doctor or the hospital. So the healthcare system is actually a sick care system. It waits until you're sick and you present to the physician or the hospital. I think in order to be sustainable and also resilient in the face of potential shocks, that has to dramatically change. And it's through defining kind of a new model for healthcare and then monitoring. Our governments are really kind of committed to funding health in a different way, but it also requires different healthcare workers that are able to work earlier on and identify people at risk, engage them proactively into their healthcare. So, a shift of human resource, financial resources into the earlier space rather than waiting until the patient presents. And that shift is very difficult to achieve, but it will only come through data, through key performance indicator, through measurements, because in the end, only what gets measured gets done, also in the health system. And so that's also where I see a huge opportunity to use data.
I couldn't agree more. And also setting the right goal and setting prevention as the goal. And certain systems tend to do that better than others. Even within the US, certain insurance companies seem to do that differently than others. So how do you convince, how do you move the whole system? I feel very, very blessed to live in the UAE because prevention is the focus and it's being set as the goal. And so a lot of different pieces will then optimize for that. That's not the case in every country. And I don't see, and no one on this podcast yet has given us the final answer on how you move systems toward paying for prevention and incentivizing prevention. Anything you've seen that's going to help us get the answer?
So, I think it's, prevention and early detection, they really belong together. And in terms of educating people about the health risks. I think general health education is always something that I find people are struggling to engage in. But if you're able to personalize that information and say, hey, you are at high risk of this and that because of this and that, I think that can change attitudes.
That's the end user. How are these systems going to transform? How are they going to move forward?
Well, Laura, I think one point is to have more people dedicated to that. But if you only dedicate 3% of your total resources on prevention, screening, and early detection, there are just not enough people to do this work. And so I think it's a gradual shift, but we have to educate and create different professions in the healthcare space that will actually do this work, that get paid to do this. And that takes time. It usually takes around 8 years to educate a doctor. So this is not something you can just put the switch on and off, one day to the other. And that is why it requires strategic planning and commitment from governments to really take this switch.
We're all going to be together having this conversation in person at Abu Dhabi Global Healthcare Week. What are you excited about at that event?
Precisely this. There's the Leaders Forum, for example, where ministers and different stewards of health systems across the Middle East and across the globe come together to exchange their points of view on precisely these topics that we've been discussing here on the podcast. So, exchanging ourselves on what is working here and why, and what could work there and why. Those are the types of conversations that are really important to have. And so I think it's through that dialogue and then really everyone having this mindset of, I can contribute something, as an individual, as a company. And that is why I think the future is really in private, public, academic partnerships around a shared agenda and a shared goal. And I think we've seen that work very well throughout the pandemic. And I'm very hopeful that we'll solve some of these big problems together in the future as well.
In 10 words or less, what do you think is the biggest challenge facing the future of healthcare?
The biggest challenge is the increasingly chronically ill population, and it really requires a shift of the healthcare system to move early, to act early on disease and early detection, early treatment. That's more than 10 words. Maybe I could rephrase that.
I think it was terrific.
But
the chronically ill, the burden of the chronically ill, caring for them, designing for them and for what the future holds in that trend is definitely on point. For that and for all of your wisdom today, Stefan, thank you so much for joining us.
Thank you, Lara, and I look forward to seeing you in Abu Dhabi.
Likewise. Thanks for listening to this episode of the Health Beats podcast. For more healthcare industry news, visit the Abu Dhabi Global Healthcare Week newsletter. The link is in our bio. And if you're interested in continuing the conversation with us, join us at Abu Dhabi Global Healthcare Week, taking place May 13th to 15th at ADNEC Abu Dhabi in the United Arab Emirates. Thanks for listening. Like, subscribe, and continue to follow Health Beats by Abu Dhabi Global Healthcare Week for your global healthcare industry digest.